Welcome to the Daily Briefing here on KLAM and KCDB, Tuesday, June the 9th, week 14 of Cordova's response to the pandemic. Mayor Koplin is our guest again today. These briefings come to you in the 1 p.m., 5 p.m., and 8 p.m. hours on the radio, and then are archived to youtube.com/Cordova TV. Want to remind you that as things kind of get into cruise control with the response, there may be some changes to how we do these. They may not be focused as much on new things that are developing, but revert to reminding people, maybe having some other guests, just because we don't necessarily need to talk to Mayor every single time. He's a busy guy and has some other things to do, but we will continue to use this time and continue to make it available. So it probably won't end up being really all that different. It may be generic a little bit more often. At any rate, today is not. We have some things to discuss, the latest on the Whittier outbreak, Cordova's feelings on that, and a number of other items provided to us by the Public Information Officer. So, with that, our visit with Mayor Koplin on this Tuesday for the Daily Briefing. Mayor Koplin, we are together again. I have my notes, you have your brain, and nice to have you back. For starters, how was the weekend?
You know, it's beautiful. We had a fantastically sunny, calm Saturday. A lot of people got out subsistence fishing. Sunday was a little bleaker. It was overcast, but still didn't get much rain. It was pretty much dry, so I had a nice weekend. Good.
Well, it's we'll take what we can get. Now, let's start here with the any kind of thoughts about what happened in Whittier, because obviously what's happening there is what has been of the greatest concern as a potential thing for here. So what's new?
You know, I was actually very interested in the Whittier case, and in fact, I got a call from their city manager, and as they were just confronting the outbreak, he recognized that both Cordova and Valdez had both had single fisheries-related cases that, in our case, were reconciled. So I think what I'd like to do is reiterate this from Cordova's perspective, that we have a really good plan in place. You know, Whittier isn't the only place that has seen kind of a spike in COVID cases over the last week. And in fact, I just saw a news flash earlier today that we had our first COVID-related death in over a month. But we have a really good plan in place. Our incident teams keep a close eye on this, and we have our precautions in place and a strong safety plan. I think what we need to recognize, and I participated in an industry call yesterday, a fisheries industry call that they host once a week. It has all the highest state leadership and Dr. Zink and Whittier and others, seafood communities and processors participating. And the state reiterated over and over, as they have in the media, that the responsibility is passing from the state and the cities with their mandates and restrictions to processors and businesses and citizens to follow their plans and follow the recommendation. That's how we're going to keep safe. They can't expect the government to do that. In fact, many are arguing, and rightly so, that there's personal and business responsibility involved. I would just say that I think the Whittier case was an example of a lapse in processors following their plans closely, and it just reiterates the importance of what we do here in constant engagement with our processors and their commitments following their plans. It's why we haven't had cases so far, and why we just need to keep doing what we've been doing.
Well, and there's also been some specific concern about Mandate 10, which has changed at the state level, which might possibly change in terms of how Cordova views that, with the more open travel from out-of-state workers. And, is that going to affect what goes on in the canneries? But actually it doesn't really, does it?
No. The processors, again, have their own plans in place. They're kind of exempted from general travel restrictions as critical infrastructure. They have to follow their plans that they have filed with the state. And in fact, we talked about the meeting yesterday. They just waive those plans as they're walking through the airports, and they don't have to show proof of the pre-testing or anything. They just need to demonstrate that they followed their plan, many, if not most of which, require testing as an element. So again, referring back to Whittier, I know there's been a lot of pressure and frustration on the part of many Cordovans that we don't just automatically adopt all of the state's requirements. However, every community is different. You look at Whittier, where almost the whole community lives in the baggage towers. It's a textbook case of how you spread a pandemic. So every community has to look at these requirements and adopt what's best for them. The city council's meeting tomorrow at noon to consider those. That has given our medical team and our incident management team time to review the state's mandates and look at following suit with the state. So the 14-day quarantine that has been in effect from June 6th until June 10th, it's quite likely. It's certainly highly possible the council, with advice of our teams, will be ready to move to the state's requirements, which are test at least 72 hours within 72 hours of departure. And then our medical team, regardless of the mandates in place, are going to continue to recommend that you quarantine and test within 2 to 4 days after traveling into the community. We have the test kits available. The transmission in airports, in planes, and ferries, as we see now, is where a lot of this spread happens. So as you come into the community, get your test, and then once you have a negative, quarantine until you get the results. And then once you get that negative result. And again, these are strong recommendations and encouragements, and we've been successful so far. So why not continue to be diligent?
Sure. Well, and take advantage of all the testing we've been provided, and as you said, that's a recommendation from the doctors and the IMT. Just a recommendation to quarantine until you've had a negative test, but it's not some kind of a mandate. So it's just good medical advice. The same way you would, if you have high cholesterol, your doctor's going to recommend changing your diet, and if you have diabetes, to be sure to take your medicine or your insulin or make those kinds of changes. It's good basic medical advice. Okay, well, moving on. My agenda here says something about an Ocean Beauty Workers Picnic.
Exactly. The processors have been looking for opportunities to get their staff out to exercise and help manage some of the jitters of being, cooped up, as it were. So we're pretty excited to announce that we've been able to work out a employee picnic for Ocean Beauty out at Sheridan Glacier on Thursday, June 11th. And we mentioned these times, of course, so that the community can know that they will all be out there, and it might be good to select a different place for you to recreate. So they're going to be setting up from 10 in the morning until noon, and then they're going to start shuttling workers out after that. So dozens of places to recreate in Cordova. I would leave Sheridan Glacier to Ocean Beauty on Thursday, and it's great that they'll have an opportunity to get their stuff out and get some exercise and enjoy the countryside. Yeah.
And emphasizing again, they're taking their own people in their own vehicles. Everybody is isolated from the community at large. They'll be out there with each other, just like they would be in the plant. They'll be outdoors, so probably not something people need to worry about, in terms of starting spread.
Exactly.
Okay, good. Well, let's move on now to the Salvation Army. I know this has been important to our public information officer to keep this information out and assistance that they're trying to make available.
Exactly. And what I'd like to highlight today is the Salvation Army has assistance funds. And whether it's immediate rental assistance or current or intermediate or immediate utility assistance, many times these state and federal programs can take a lot of time, whereas your rent or your bill payments don't wait. And so if you do need immediate assistance, the Salvation Army is there to help. And you can get a hold of Jenny Ragland at the Salvation Army at area code 907-339-3440. That number again is 339-3440.
Okay. Well, as we start, it's funny. I was going to say, as we start to wind it up, maybe we ought to summarize the testing times. But the test results are always of interesting. What are the latest numbers there?
Well, we continue to see lots of testing. I want to continue to encourage all Cordovans and especially travelers, fishermen, to test and make sure that we can keep the spread to the community down and to our processors so we can keep our efficiencies rolling. But we have administered a whopping 652 tests through midnight last night. We have no active test results. We have 650 negative test results. So there's results are pending for 11, and we do have that one recovered test. And then we have 1,100 plus testing capacity.
Yeah, it's interesting. I've seen that number in our notes here stay static at 1,100, but I've heard the doctors mention a few times that we actually have even more than that. So anyway, lots of tests. And then in the home stretch here, maybe quick talk about the times for testing and those phone numbers that are out there for folks if they want to be able to use those for information.
You bet. And so for the rest of the week, today, Thursday, and Friday, so Tuesday, Thursday, and Friday, testing will be free from 9 a.m. to 10 a.m. at the Cordova Community Medical Center by the ambulance bay. That's by the emergency entrance there. And then tomorrow it's going to be at the Alaka Community Health Center, and that's from 1 to 3 p.m. tomorrow afternoon. Okay. So that's where testing will be available. Okay.
And then those phone numbers again?
And the phone numbers for information is the 424-INFO, and that's the COVID-19 information line, just about anything COVID, 424-INFO. And then the wellness line, supported by the Native Village of EAC, is 424-WELL, 424-WELL. And that will give you a daily update on the latest information from the incident management team.
Okay. And there was another note in here kind of regarding well-being, mental health, just making sure, because there's a lot going on, not just the pandemic, but obviously the social issues that are occupying the news cycle. What was some of the advice that came out about dealing with that?
Well, remember, as you're keeping up with the current news and reading about all of the COVID-19 and then the spikes in cases, it's easy to get nervous or anxious or stressed out, and you get that heightened alpha mode, I call it, where you get your hypothalamus wound up. And instead of staying attached to that news and keeping that constant barrage of negative and frightening information, it's a great time to get out for a walk, get some exercise, unwind, and do activities that you enjoy, whether it's gardening or working around the house, preferably outdoors, and connect with friends as you socially distance.
Okay. And speaking of that, let's conclude then with these main points that the doctors, that the council, everybody that is in the lead on this would like people to do to be sure they keep safe.
Absolutely. And I have to say I have seen a mild erosion of people following these rules indoors. And I just have to underscore that's our responsibility as individuals now to wash our hands frequently, wipe down those high-touch surfaces if you operate a business or share touch surfaces. Practice your social distancing of at least 6 feet. And if you can't, have a mask on. Keep your interactions with others limited, and try to keep track of your interactions in the places that you visit, just in case you do test positive or come down with symptoms. And you can have a pretty good idea of who else you may have infected.
Kathy Sherman's actually been a good example of that. She's told us before that she journals when she goes somewhere. Anytime she goes out, it's the day and when it was, and anybody that she came in close contact with that wasn't in her household or in her limited sphere of interaction with other people. I think that's a really good example. And with a phone, it's probably not all that hard to do. You don't even have to write anything. You could just open up a Google Doc and speak and do voice typing. So, good idea. And anything else before we call it good here?
No, we've got a good plan in place. Just need to keep following it, and we wish Cordova a safe and successful week.
Okay, well, we'll see if we can get together again tomorrow. And then, of course, that council meeting, very important. Once more, that's tomorrow at noon.
Yes, exactly. And that call-in number, again, 253-6202.
All right, sounds good. Thank you again, Mayor Koplin. We appreciate having you here. We appreciate folks listening to the Daily Briefing, this one for Tuesday, June the 9th. on KLAM and KCDV when it's on the radio, and at youtube.com/Cordova TV. Any of you listening to us there, we welcome you. Thank you for taking advantage of that service. We will, for this week for sure, continue to be each weekday at 1 p.m., 5 p.m., and 8 p.m. That may relax slightly going forward, but of course there will always be a series of them if necessary, anytime something significant develops. And again, we'll probably always have something in this time slot. We appreciate those of you that have made a point of tuning in and want to continue to provide you information. We'll look forward to having you for our next program, which again should include Mayor Koplin. That's our plan for the rest of this week. Things always change, so we never make predictions anymore. And right now, we'll get you back to regular programming on KLAM and KCDV.